Coordinating care plans and ensuring comprehensive patient support in fertility care. Effective care coordination is crucial in fertility care to ensure patients receive the most holistic, well-rounded treatment experience. Fertility care often involves a range of medical, emotional, genetic, and psychological factors, making it essential to provide a comprehensive support system. Coordinating care plans allows fertility specialists, mental health professionals, genetic counselors, nurses, and other healthcare providers to work together to meet the diverse needs of the patient. Here's a breakdown of the key aspects of coordinating care plans and ensuring comprehensive patient support in fertility care. 1. The importance of coordinating care plans. Coordinating care plans in fertility treatment ensures that patients receive the necessary support at each stage of their treatment journey, from initial consultation through the fertility treatment cycle and even beyond. Key reasons for care coordination include holistic approach. Fertility patients often face both physical and emotional challenges. A coordinated care plan ensures that medical treatment is balanced with emotional and psychological support. Improved patient experience. Having a clear care plan with coordinated efforts helps reduce confusion, provides consistent messaging, and makes the treatment journey smoother for the patient. Optimal outcomes. Effective coordination among specialists helps ensure that the treatment plan is tailored to the patient's needs, which increases the likelihood of successful treatment and a positive experience. Prevention of gaps or duplication. Care coordination helps avoid gaps in patient care or duplication of services, leading to more efficient use of resources and better overall care. 2. Key members involved in coordinating care plans. Fertility care requires input from various specialists, each of whom contributes to a patient's comprehensive care plan. Coordination among these specialists is essential to achieve the best possible outcomes. A fertility specialist, reproductive endocrinologist. Role: manage the primary medical treatments related to fertility, such as ovulation induction, in vitro fertilization, intrauterine insemination, and other assisted reproductive technologies. Collaboration: fertility specialists collaborate with genetic counselors, mental health professionals, and nurses to create a treatment plan that addresses the patient's physical, genetic, and emotional needs. B. Mental health professionals. Role: provide psychological support throughout the fertility journey, addressing issues such as stress, anxiety, grief, and relationship strain. They help patients and couples cope with the emotional challenges associated with infertility and fertility treatments. Collaboration: mental health professionals work with the fertility team to ensure that patients are emotionally prepared for each stage of treatment and that the psychological aspects are not overlooked. C. Genetic counselors. Role: provide counseling on genetic risk, family history, and the implications of genetic conditions on fertility treatments. Genetic counselors may assist with pre-implantation, genetic testing, PGT, carrier screening, and genetic counseling related to the risk of inheriting diseases. Collaboration: fertility specialists and genetic counselors collaborate to determine the best approach for genetic testing and ensure that the patient is well informed about their options. D. Nurses and physician assistants role: provide ongoing care, education, and emotional support to patients throughout the fertility treatment process. They assist with medication administration, patient monitoring, and post-treatment care. Collaboration: nurses and physician assistants help coordinate communication between patients and specialists, ensuring patients understand treatment plans and receive adequate follow-up care. Embryologists and andrologists role: embryologists are responsible for handling embryos during IVF treatments, monitoring their development, and ensuring proper freezing and storage. Andrologists focus on male fertility, analyzing sperm quality and assisting with sperm retrieval. Collaboration: these specialists collaborate with fertility doctors to ensure optimal egg and sperm quality, and their work is integrated into the care plan to maximize treatment success. 3. Developing and implementing coordinated care plans. A well-developed coordinated care plan includes the following components. A. Initial consultation and assessment. Medical history and diagnosis. The first step in coordinating care is conducting a thorough assessment of the patient's medical history, fertility challenges, and emotional well-being. Multidisciplinary input. Specialists from various areas, fertility, mental health, genetics, gather information to assess all aspects of the patient's needs, and a comprehensive treatment plan is developed. Setting expectations. Ensure that the patient understands the process, including potential risks, treatment cycles, and any emotional challenges they may face during treatment. B. Ongoing communication between specialists. Regular team meetings. Regular meetings or check-ins between fertility specialists, nurses, mental health professionals, genetic counselors, and other team members are essential for discussing the patient's progress and adjusting the care plan as needed. Shared electronic health records, EHR. Use of secure shared electronic health records ensures that all specialists have access to the patient's medical history, treatment updates, and any ongoing concerns, leading to better care coordination. C. Tailoring the care plan to the patient. Medical and psychological balance. Ensure that the medical treatment plan is balanced with psychological support. For instance, if a patient is experiencing significant emotional distress or anxiety, these can be addressed with therapy or counseling before proceeding with further medical treatments. Genetic and ethical considerations. For patients with genetic concerns or those undergoing third-party reproduction, egg, sperm donation, or surrogacy, genetic counselors are involved in making informed decisions that align with both medical and ethical considerations. Personalizing the plan. Adapt the plan based on the patient's needs, preferences, and responses to treatments. For instance, if one treatment cycle fails, an adjustment may be necessary to improve the chances of success in subsequent cycles. 4. Continuous support and monitoring. A. Emotional and psychological support. Ongoing counseling. Mental health professionals should provide continuous counseling support throughout the treatment cycle, especially during stressful or challenging times such as failed cycles, miscarriages, or difficult decisions about embryo disposition. Support groups. Support groups or online forums for patients experiencing fertility challenges can provide an additional layer of emotional support and social connection. B. Monitoring progress and adjusting plans. Medical monitoring. Fertility specialists should closely monitor the patient's response to treatment through regular visits, blood tests, ultrasounds, and other assessments. Adapting the plan. Based on monitoring, treatment adjustments may be needed, e.g., changing medications or timing of procedures. These changes should be communicated clearly to the patient and integrated into the overall care plan. 5. Addressing challenges in coordinating care plans. A. Communication barriers. Solution: foster open, clear, and regular communication between specialists. Use electronic health records to ensure all specialists have access to the same information. B. Emotional strain. Solution: offer regular psychological support and coping strategies for patients. Addressing emotional challenges is as important as medical treatment for fertility patients. C. Conflicting recommendations. Solution: ensure all specialists involved collaborate closely and discuss recommendations with the patient. Provide the patient with a clear, unified approach that aligns with their goals and needs. 6. Conclusion: coordinating care plans and ensuring comprehensive support is essential for successful fertility treatment. The collaborative efforts of fertility specialists, mental health professionals, genetic counselors, nurses, and other specialists help ensure that patients receive the best possible care. This multidisciplinary approach addresses the full scope of the patient's needs: medical, emotional, and psychological, leading to improved outcomes, better patient satisfaction, and a more positive fertility journey.